Long COVID is a term used to describe the effects of COVID-19 that continue for weeks or months after the initial infection. A study involving Dublin's Mater Hospital Long COVID Clinic has found that psychiatric and psychological problems are much more prevalent among people with long COVID, and there are also concerning levels of alcohol misuse. Over 1,000 patients with long COVID have attended the clinic since it started in mid-2020.
Brain inflammation causes psychiatric problems, so a lot of depression, a lot of anxiety, problem alcohol use, people trying to cope probably with the trauma of having long COVID, PTSD. So we're finding, these are people that didn't have these conditions before.
This study of the effects of long COVID involved 155 patients over 14 months. Over 18% reported moderate to severe depression for at least a year. 21% had post-traumatic stress disorder for at least a year, and 72% had concerning alcohol use, mostly as a coping mechanism. A quarter of patients attending the long COVID follow-up clinic here at the Mater Hospital say they still have symptoms a year after their initial infection. Many report considerable fatigue, and a third say they've difficulty concentrating and have so-called brain fog. The authors of the study say it means that long COVID clinics will need to have neurological and psychiatric service supports, along with the existing team of specialists, as well as a greater support for GPs around the country given the scale of long COVID. The study was funded by the Health Research Board. Meanwhile, there's been an increase today in the number of patients in hospital with COVID-19, with 271 reported, of which 26 are in ICU. Fergal Bowers, RTE News.